If you or someone you know is suffering from urinary difficulties, you may want to hear Ron's story regarding what he just went through. Ron, thank you so much for sharing your story regarding your urinary journey. Can you tell us, before you came to Sunrise Urology, what were you going through?
Well, I was probably getting up 4 or 5 times during the night and going to the bathroom, never having a very good flow. Sometimes you get in there and it doesn't work, you know.
Mm.
And so, you're playing golf or you're doing anything, and it's just, you got to stop all the time, and it was getting to be crazy uncomfortable. And so
How was that being treated?
I was taking medication for it, and I'd taken this medication for probably started in 2000. And so that was, 22 years or so. And
Sound like it wasn't working anymore.
yeah, I don't know. Yeah, I don't know how it was working in the beginning, but I do know at the end it wasn't working. And when you went in and took a look at what I had, um, it was really the right move to make, because with that pushing up into my bladder, that would create other problems
Mhm.
other than the prostate, which would be a lot worse, you know.
So what I did was, as part of your evaluation to find out why you were voiding so poorly despite taking medication, I performed a cystoscopy looking inside the bladder. Now, a lot of patients are very afraid of that procedure, thinking, "Oh my gosh, it's horrible." What was your impression?
Absolutely no pain, uh, just just less than anything that I've probably done. Is I was just saying that even the surgery was less than going to the dentist. I mean, it was in the center that we went to, your surgery center. It was so professional. I was in and I was out, went home, and the procedures you gave me, everything went well.
So let's go back a little bit. I looked you for 20 some odd years, you were suffering with urinary problems, you took medication, eventually it may have quit working or never worked, we don't know. And then I said we should look inside the bladder. You had a cystoscopy. It showed that your prostate was pushing into the bladder. And then we talked about the various treatment options. You ended up deciding let's go through with a TURP, also known as a roto-rooter. And you went through that procedure and you were commenting about the surgery center and how nice it was and how nice the people were. Is that what I'm hearing you?
Oh yeah, 100%. I went in there, everything was so professional and very comfortable in and out. It wasn't a long procedure. Didn't feel like it to me. you know, I was out for some of it, but it, I just couldn't recommend it enough. If you're waiting or putting off having it checked or done, you should really think twice about it, because why I would want to go through this any longer. Um, it was so much nicer now that I'm done. I'm back. My life's almost back to normal as far as functions, and I would recommend it highly.
It sounds like you're telling folks not to wait if they're suffering with urinary difficulties. You want folks to get it evaluated and treated sooner than later.
Well, yes, very much so, because if you think about it pushing up into my bladder, could have caused some other problems. Yeah, if you got a problem, get in, get it taken care of. Don't hesitate, because and I can't. Your staff and yourself, I mean, beautiful job. I can't complain about a thing. I mean, everything went so well.
So, what has changed with your urination and how has that impacted on your quality of life?
Oh, it's tremendous. I'm like a racehorse. I'm 76 years old. you know, I feel so good.
You were able to take a car trip recently. Can you tell us how that went?
Yeah, I drove to Napa, California, nonstop, 14-hour drive. I could go 3.5 hours before I even decided to go to the bathroom, which would have never happened before. I used to have to stop all the time, and it was just a total inconvenience. You're always running to the restroom or feeling like you have to go and then you can't go, and um, getting up during the night is the worst thing, and because you break up your sleep.
Hmm.
You know, I can't. Ex- I get up maybe once, and I'm not so sure I'm getting up because it's my wife gets up. But I'm telling you, I feel rested. I can sleep. My sleep uh, pattern is so much better. I feel so good about that, and that's really been one of the big bonuses of doing this.
Yeah. Being able to sleep at night certainly helps with your mental status, makes you feel much better during the day, makes you more productive, and really enjoy your life.
Yeah, absolutely, 100% on that. Because and that would be the another big reason to get this taken care of at a right away and stop. Or once you have a problem with it, at least go in and get it checked out, find out what's going on, and then at least you can have some peace of mind.
Yeah, yeah, definitely. Now, a lot of guys, before they go through the procedure, they'll do their online research and they hear stories about urinary incontinence, meaning leaking and peeing on themselves, or sexual erectile dysfunction. What has been your experience after TURP?
I've had none. I mean, it was just like I say. I went in, I got it fixed, and now I can go to the bathroom, and every other function is fine. Now, I think a lot of people that wait too long, and if you have other issues like your bladder or I think if you just waiting too long is not a good idea. Get in there, find out what's going on, and then keep up with it.
Well, it sounds like you came in just in time, had an intervention which really improved your quality of life.
Oh, no doubt about it. Yeah, it will, especially if I don't ever have to have anything the rest of my life. This is a big deal.
Most likely, after a TURP at 76, this will most likely last for the rest of your life. Well, Ron, thank you so much for sharing your story.
Oh, no problem at all. But get checked up.
I think that's great advice.